my name's Jonathan Lee, and it's a pleasure to be able to introduce some of our recent research to you today. I'd like to thank Ramon for the introduction to speak at this symposium. And what I'm going to present to you is some of our recent efforts in using the value of animal models to inform therapeutic practice. Now, the particular condition that's been interesting us is post-traumatic stress disorder. And you will well know that PTSD results from a traumatic experience, and some of the symptoms that accompany the experience of PTSD or the lived experience of patients with PTSD are these intrusive re-experiencing episodes, efforts to avoid reminders of trauma, and hyperarousal and hyperreactivity. And it's commonly accepted that memory is at the heart of this condition, in the sense that it is the memory for the traumatic experience that can provoke these symptoms ongoing through the patient's life. Now, one of the approved therapeutic approaches for PTSD across many countries, including Brazil, is eye movement desensitization and reprocessing. This was developed by the psychotherapist Francine Shapiro many decades ago. And at its core, it involves the use of regular horizontal eye movements or other forms of bilateral alternating stimulation in combination with stages of talking therapy. Now, it's a relatively complex therapeutic process, and I don't have time to go into it, but at its core, the hypothesis that underlies EMDR is that the traumatic memory in PTSD patients is inadequately or incompletely processed. And the therapy that encompasses eye movements and the talking therapy allows effective and adaptive reprocessing or updating of this traumatic memory so that it no longer interferes so dramatically in everyday life. Now, despite the fact that EMDR has been shown in many studies to have therapeutic benefit and robust therapeutic benefit, part of the drawback in convincing the wider population, both clinicians and patients, is that there is an ongoing search for an actual neurobiological mechanism of action. So it's still not clear how EMDR is so effective. There have been studies in humans, including neuroimaging studies, that provide us some ideas. But on top of that, in recent years, there's been an emerging interest in modeling EMDR in experimental rodents. Now, the classic study of fear or traumatic memory in experimental rodents is fear conditioning. And this involves exposing rats or mice to an electric foot shock. And this at test provokes a defensive freezing response that we can observe and quantify. And the delivery of the electric foot shock can be either paired to an environmental context or to an explicit cue, for example, a sound or a tone. And so upon representation of that tone, that elicits this freezing response. I just want to show to you, for those of you who haven't seen an example of this freezing response, what it looks like. This is a rat that is freezing. It's being re-exposed to an environmental context that it previously received an electric foot shock in. And you can see intermittent, very small movements. But this rat is demonstrating the freezing response, the idea being that it may be re-experiencing or avoiding a potential future threat. Now, there are many processes that take place in the lifetime of a memory. I'm going to highlight two because they are particularly relevant potentially to eye movement desensitization and reprocessing. The first is extinction, which is linked to exposure therapy. So after a memory has been formed, simple exposure to cues or a context leads to the formation of a new extinction memory that suppresses any expression of the fearful memory. What we know from extinction is that there are many conditions under which the memory or expression of the original fear memory recovers from extinction. And what this means is that simple exposure therapy is often not very effective in the long run because trauma can recover from that exposure therapy. But there may be ways of enhancing extinction such that it's less likely to demonstrate recovery. Now, alongside this, as a memory process, is memory reconsolidation. I'm not going to go through this in detail now, and I'll explain it a bit more in a little bit. But essentially, reconsolidation is hypothesized to be a process that is necessary to restabilize recently retrieved memories. And in the absence of a successful restabilization, the memory can decay, and with impaired reconsolidation, the trauma or fear memory may be unable to be expressed and influence behavior. So what relevance is all of this to EMDR? Well, within EMDR therapy, key elements are that the traumatic memory is reactivated and that this bilateral alternating stimulation or eye movements is an essential element of the treatment, as developed by Francine Shapiro. And so some have argued that the combination of bilateral alternating stimulation with this memory reactivation might mean that bilateral alternating stimulation might be enhancing extinction. Now, Wirtz et al. Relatively recently have modeled this in experimental rodents. What they did was bilateral alternating stimulation of the eyelid muscles and paired this with presentations of a previously fear-conditioned tone. And what they showed is that, I'll just highlight the relevant data here, is that the combination of bilateral alternating stimulation, these purple bars, combined with extinction, led to a much lower level of freezing at a test compared to in the absence of bilateral alternating stimulation. And the interpretation of this is that bilateral alternating stimulation does enhance extinction. But I want to return to some core elements of EMDR therapy. And we agree that memory is reactivated as part of the therapeutic process. But actually, if we think about EMDR, bilateral stimulation is only part of the treatment. And actually, there's a great emphasis on the therapist aiding reprocessing of the inadequately encoded traumatic memory. And what Shapiro herself has highlighted is that the prolonged exposures as used in cognitive behavioral therapy resulted in extinction, whereas the brief re-exposures as recommended for use within EMDR therapy are more likely to trigger memory reconsolidation. And so it might be that EMDR is accessing and utilizing reconsolidation rather than extinction. So what I want to do now is explain in a bit more detail how reconsolidation might be relevant to EMDR therapy by analyzing what is going on within reconsolidation. So this is a useful analogy for what goes on in reconsolidation. We have embedded and acquired within our memory systems stable memories, and we might use as an analogy ice cubes, so solid ice cubes as an analogy for stable memories. And what happens within the reconsolidation process is sometimes upon retrieval or reactivation of the memory, that can destabilize the memory. Analogously, the ice cubes might be destabilized or might melt. And what that requires is for a restabilization process or reconsolidation in order to reform the memory into a stable long-term state. So the melted ice cube needs to be refrozen. And so we can see how heat may destabilize the ice cube, destabilize the memory into a more malleable state. And if we introduce a mold and put the melted water into a mold and refreeze it, that has the potential to remold the memory and update it. And so what we increasingly believe is that reconsolidation is a mechanism by which stable memories might be able to be updated or reprocessed so that they maintain their relevance and utility in the new environment or new situation. And so this does align with ideas of EMDR. So EMDR therapy is posited to allow memory reprocessing, whereas reconsolidation, we believe, allows memory reupdating. So there is an alignment there. And so we've been exploring a hypothesis that bilateral alternating stimulation within EMDR therapy may be enhancing destabilization in order to facilitate the reprocessing of memory via reconsolidation. One of the reasons we believe this might be a reasonable hypothesis is that, as I've already introduced to you, bilateral alternating stimulation enhances extinction. And we know from a lot of the literature on reconsolidation and extinction is that the mechanisms of extinction and those of destabilization are very similar and potentially identical. And so because bilateral alternating stimulation enhances extinction, we might reasonably suggest that bilateral alternating stimulation also enhances destabilization. And we already know that it is possible to enhance destabilization using pharmacological approaches. And one of the pharmacological approaches that we have used in our lab is being the application of a cognitive enhancer, nefurosetam. And I'm just going to briefly introduce this as a context for our more recent evidence. So this is work conducted by Charlotte Flavel in the lab a few years ago. And what Charlie did was to have groups that received nefurosetam in combination with a drug that we knew would impair reconsolidation, mifepristone, a glucocorticoid antagonist, and compared that group to groups that received only nefurosetam. Hypothetically, the nefurosetam would enhance destabilization, but there would be no barrier to the memory reconsolidating because there wasn't any mifepristone being applied. And also this group on the right-hand side, a group that received only mifepristone, and we were using conditions under which we knew that the reminder that we were employing was not able alone to destabilize the memory. And so the application of mifepristone by itself wouldn't be expected to impair the memory. And what we observed was that nefurosetam plus mifepristone did result, at least in a subset of the rats, in an impairment of freezing, expression of the fear or traumatic memory at test, compared to the other two groups. And what this suggested to us relatively strongly was that nefurosetam was enhancing destabilization, therefore requiring glucocorticoid activity in order to restabilize or reconsolidate the memory. And so the application concurrently of mifepristone impaired the reconsolidation to result in a weakened, less expressible memory. And so just to reiterate our hypothesis, what we were thinking was that bilateral alternating stimulation may stimulate destabilization. Therapeutically, that's providing a gateway for reprocessing in EMDR therapy. In our particular situation, it's providing a gateway to stimulating destabilization and provoking the fear memory to needing to undergo restabilization, which could be interrupted by the application of mifepristone. Now, the bilateral alternating stimulation that we used in our experiment was bilateral alternating whisker stimulation. This is a very low-tech solution. As you may well know, the predominant sensory modality in experimental rodents, or in rodents in general, is whisker stimulation. rats have an enlarged barrel cortex that allow them to sense the external environment through vibrations of their whiskers. And this is in contrast to a very low spatial resolution, a low sensory acuity for vision in experimental animals or experimental rats. And so we thought it was appropriate to use the predominant sensory modality. And what we did was to use a paintbrush to brush the whiskers, alternating left and right at a 1 Hertz stimulation, the same kind of frequency of stimulation as in EMDR is used with the horizontal eye movements. And so we did that, and the control was to brush the whiskers always on the same side, so unilateral whisker stimulation. And we had the same equivalent 3 groups as we did for the mifepristone group that I've pasted in the top right-hand corner here. So the main experimental group of interest was the one that received the bilateral alternating whisker stimulation and also was injected with mifepristone. We compared this to a group that only received bilateral alternating whisker stimulation and a group that used the control unilateral whisker stimulation combined with mifepristone. Now the data here are a bit messier, there's a bit more variability in this experiment, but statistically the pattern replicates what we observed in the pharmacological study. So the group that received bilateral alternating whisker stimulation in combination with mifepristone generally had a lower level of freezing at test compared to the other groups, even though there's greater variability overall. So again, the interpretation that we have for this is that bilateral alternating stimulation did enhance the destabilization of the memory, requiring that the memory underwent a reconsolidation, restabilization process, which was then interrupted by the application of mifepristone. And this essentially leads to some support for the hypothesis that bilateral alternating stimulation is facilitating updating and reprocessing of the memory by stimulating destabilization and engaging reconsolidation. So that's part of the summary, that memory is at the core of PTSD and some other conditions. And I would acknowledge that EMDR is being explored as a therapeutic approach in not only PTSD, but many other psychiatric conditions. And we have some supporting emerging evidence that bilateral alternating stimulation may stimulate destabilization to facilitate the engagement of reconsolidation in order to help the updating and reprocessing of the traumatic memory. I would acknowledge that there's not yet any supporting evidence in humans for this hypothesis, but it is something that we're hoping to explore in greater detail in the very near future. So I'd like to acknowledge my funding from some UK funding agencies, but more particularly for those who've undertaken and led on this research, Charlotte Flavel and an excellent technician, Dave Barber, and collaborators who have stimulated discussions that have led to these ideas listed on the right here. I thank you for your attention, and hopefully you'll be able to access my contact details, and I'd welcome any discussion and any contact over email if you wish to do that. Thank you and enjoy the rest of the symposium.